Hi, my name is Mikhael El Chami. I'm one of the cardiac electrophysiologists at Emory University Hospital Midtown. I'm an assistant professor of medicine with the Emory University School of Medicine. We will be discussing today drug treatment for atrial fibrillation. Atrial fibrillation is one of the most common abnormal heart rhythm. It affects close to 6 million people in the United States, and the number is expected to rise simply because people are living longer and they're surviving heart attack. And previous heart attack or any heart disease, in addition to age, are important risk factors for atrial fibrillation. Drug treatment is the first line of treatment for atrial fibrillation. And there are several classes of medication that we could use to help patients with atrial fibrillation feel better. Drugs such as beta blockers or calcium channel blockers are well-known drugs used usually for the treatment of hypertension, could be used in the treatment of atrial fibrillation to slow the heart rate during atrial fibrillation. These drugs are usually used in older patients who are not candidate to try the other more sophisticated drugs called antiarrhythmic drugs. Antiarrhythmic drugs are drugs used to prevent the AFib from coming back after we treat it successfully. And the success rate of antiarrhythmic drugs in preventing AFib from coming back are 40 to 50%. Patients respond differently to different medications, so it's very important that patients with AFib follow closely with their specialist in order to get to the best drug that could prevent atrial fibrillation from recurring and could help them feel the best and prevent emergency room visits or doctor's visit. If you have atrial fibrillation, please schedule an appointment with your cardiologist to discuss the best treatment option. Thank you for listening today.